You're listening to the Exploring Fitness Podcast, Episode 6. In this week's episode, Dr. Dan talks with a local personal trainer who specializes in helping women with strength training through pregnancy and their postpartum return to true normal. In 3, 2, 1, go. I'm Dan Dalator. In over 10 years of experience as a clinician and a coach, I've worked with hundreds of athletes to help them improve their health, wellness, and fitness, but still feel that there is so much more for all of us to learn. This is a podcast dedicated to furthering our understanding of health, wellness, fitness, and how to apply these concepts into our daily lives to create true and lasting changes in your fitness and health. This is the Exploring Fitness Podcast. When treating patients with a certain injury or helping an athlete achieve a new skill, it always helps to be able to relate to that specific person's situation. I can better give someone a comfortable sleeping position if they have an AC joint sprain, or give more relevant cues to eliminate chicken winging during a bar muscle up, because I've personally experienced and had to overcome those things myself. One thing that I can almost guarantee is that I will never be pregnant, so I won't be able to relate to pregnant or postpartum women as well as my next guest. As you'll hear, being able to relate to her own clients helped her not only get through her own pregnancy, but I think now makes her more capable of serving those individuals through her own experiences. All right, welcome back everybody to another episode. My guest today is a National Academy of Sports Medicine certified personal trainer. She also has certifications or special training in pre and postnatal personal training, kettlebell concepts, and TRX. Meg Seehagen, welcome to the Exploring Fitness Podcast. Did I say that correctly?
Seehagen, yes.
Yeah.
You did. Good job.
Yeah, thank you. So the first question I ask all of my guests, what is fitness to you?
What is fitness to me? It's a measurement of your health. There's no variable or health marker that can't be improved by being more physically fit. Your body functions better and you have more personal freedom to do the things that you want to do. And that state of well-being allows you to perform, your daily tasks without too much resistance.
Oh, I love that. I think that makes a lot of sense. The measure of health and health markers, and I don't know if have you ever taken the CrossFit Level 1?
No.
No? Okay. So one of the methodologies, or I guess one of the models behind the CrossFit methodology is called the Sickness, Wellness, Fitness Continuum.
Oh, interesting. Yep.
And their idea is basically the same thing, that there's no marker that you can't fit somewhere on that continuum.
Yeah.
For example, if you take somebody's BMI, you can pretty much tell where they would fall in the sickness, wellness, or fitness continuum.
Yeah, so, sure.
Yeah, I love your definition.
All right, thank you.
Yeah, so can you kind of jump into telling the audience a little bit about yourself, some of your background, who you are, what you do, that kind of stuff?
Yeah. So I've been a coach 8, going on 9 years now. I was born and raised in Maine. I went to USM and got my undergrad degree in exercise physiology. And I always kind of pictured myself working in the medical field. And I went on to do my first job out of college was at a chiropractic office. So I was their assistant. I did a lot of the exercise and followed the doctor's prescriptions for patient. And I did a little bit in cardiac rehab as well. And after a few years of that, I kind of decided that I wanted to be on the preventative side of medicine. It was less challenging. Well, challenging might not be the right word. Felt less challenging to me personally, but was probably more challenging in the medical field. But felt less challenging for me to be working with people who didn't really want to be in a physical therapy or chiropractic office or at cardiac rehab, or had already experienced some really big traumatic event that they were trying to take a step back. And so I decided to become a personal trainer and work on the preventative side of health. And so I got certified in 2015. And at that time, my husband got a job offer in Boston. So we packed up. I didn't know anybody. I had friends there, but I didn't really know like a client list. And I went and took a job at an all-women's strength gym there. And I worked there full time for 5 years. And during the pandemic, we decided that we wanted to be back in Maine. We always kind of knew we wanted to be back in Maine, but it was a good push to come back to Maine. And I started an online virtual training business at the time. And I got connected to Iron Legion through some mutual friends. They just thought that we would be a good fit. So I reached out to Scott, and I have been there since. So it's been about 4 years.
So you're currently at Iron Legion. Can you tell everybody a little bit about what that is and kind of what you do there?
Yeah. So Iron Legion is a strength gym that's located in Westbrook, Maine. We specialize in strength. We have about 10 to 12 coaches at the Westbrook location. We also have a location in Scarborough with about 4 or 5 coaches. And we do a lot of powerlifting, but I wouldn't say we're a powerlifting, specific gym. But a lot of our methodology there is just working through barbell, big compound movements, and working to get people stronger. So that's really our focus. We do have some like conditioning classes and some conditioning work that we do with our clients, but a lot of it is barbell and strength.
So would you say like primarily like the big 3, like deadlift, bench press, back squat, or do you guys incorporate other barbell?
Yeah. Mainly the big 3, deadlift, squat, and bench. Lots of overhead press, barbell rows, pull-ups, push-ups, all those good markers as well.
All the good accessory stuff.
Accessory stuff, yeah. We're not really built to take on Olympic lifting just at our facility with the equipment that we have and the floor that we have. But we do a little bit of like Olympic lifting or with dumbbells and kettlebells and stuff like that as well.
Love that. Do you still feel like you're in the preventative side of things with what you're currently doing?
I do. It's fascinating how personal training can almost feel like people's last stop. So if somebody experiences back pain, they've maybe gone to their doctor, gotten an MRI, maybe gone to PT, maybe not, and learned to sort of live with this threshold of chronic pain. And so those people then going, I think I want to try strength training. A lot of times we're not even like, it's out of our scope to diagnose these types of things, but a lot of times getting stronger just helps and sort of fixes these things on its own, assuming it's no, major traumatic injury or accident. And so in some sense, I do feel on the preventative side, and it's people that want to be there, which is really, really exciting. But there is definitely still a good handful of clients that have, people have their things and their aches and their pains and, various health markers that need to be improved, pre-diabetic, hypertension, these types of things.
Yeah, I love that. So I like to think of prevention in kind of three different phases.
Yep.
Primary prevention is helping prevent something from ever occurring in the first place. So getting that person into the gym before they ever have an injury and trying to keep it that way. Secondary prevention, once they have an injury, helping prevent it from getting worse. And then tertiary prevention, once that injury is gone, helping prevent it from ever coming back again.
Yeah,
So,
I love that.
I, I totally believe that strength training is a big part in any of those three.
Yeah.
And there's actually a good bit of evidence suggesting that somebody's back squat can be indicative of whether or not they'll have lower extremity injury. And there's there's tons of different studies like that. So I think it's important that people know just how much strength training can help prevent injuries in the first place.
Yeah, no, that's awesome. I didn't know that. I'd love to see that study.
No, I'll have to send it your way, or maybe I'll link it in the show notes.
Yeah,
so that everybody can see it. So what do you think is one thing that you wish some of your clients or members would kind of focus on doing or improving?
That's a great question. I do really wish that people, our clients are not just people who want to strength train in general. I think that we could all do a better job of focusing on the small wins. Um, and part of that is, this barrier to going to the gym in general is so big for some people that they'll never go, right? And so the first small win there is just calling a place or signing up for a place or just going to a place and walking through the doors. Sometimes the small wins are just being able to tie your shoes without back pain and these types of markers. But we have these grand ideas of I'll never do a push-up, I'll never do a pull-up, I'll never deadlift my body weight. And those are all, equally as exciting to accomplish. But the small wins are really what push you to get there. So if I had to pick something, I wish that more people recognized what just stepping into the gym is accomplishing for them.
Yeah, that's a huge step for a lot of people, even just kind of building up the courage and kind of initiating that process in the first place.
Totally. And I've had clients that, they come in for their first consult and they will say stuff like, I've been following you for years. And, I actually had an appointment set up 2 or 3, or I had one girl that was like, I've had 10 appointments set up and I never came to any of them, or I canceled or I moved them. And it's scary. It's a scary thing to walk into a place that you don't know. And, it's just intimidating. You don't know how it's going to feel, who's going to greet you on the other side of it. So yeah, I think the small wins are there.
Yeah, and especially for people who may not have ever touched a barbell before or have any experience with some of these things, it can be overwhelming.
Absolutely.
So who do you think your ideal client is?
That's a good question. At Iron Legion, we have anywhere from 12 years old to our oldest client right now is 78 years old. But, if a 90-year-old came knocking on our door, we would absolutely accept them. So I wouldn't say picture perfect that we have an ideal client so much as we just love helping people find what makes them strong across the board. So, if we specialize in a lot of powerlifting, if that's sending somebody to their first meet or 20th meet, then that's great. But we equally get as excited for, the 12-year-old kid that wants to feel a little bit better in his body, or the 70-year-old's grandmother who wants to sit on the floor with her grandkids. Yeah. General population.
Great. Love that. Meeting people where they are and their goals.
Yeah, exactly.
Do you feel like you have like a personal style to your programming?
Um, I've done a lot of different things over the last 9 years. Like personally working out, I've tried CrossFit, I've done powerlifting, I've done not bodybuilding to the extent of doing competitions, but bodybuilding style training, um, conditioning, running, and I think that for the general person who's just trying to move better, feel stronger in their daily tasks, I like to just kind of pull a little bit of everything from what I have personally done. Um, my programming it depends on the person, honestly, but for the most part, I would say my programming is, full body days. We have a main lift. We have accessories that complement or are the exact opposite of the main lift. Um, and then I usually like to end, if people are on board, I like to end with a little conditioning workout for them.
Love that. Ending with conditioning. Um, when did you get started with the pre and postnatal stuff?
So pre postnatal, I actually, because I accepted that my first job was in all women's gym, they really emphasized women's health, of course. And this was back in 2015, 2016. So pre and postnatal exercise, not even just strength training, but pre and postnatal exercise was not huge at the time. It was just kind of coming, you know, being a buzzword. Um, and it was kind of at everybody's discretion. Not a lot of doctors knew it, but encouraged it in some capacity. Um, and at this gym, the head coach um, got certified to teach a certification course in pre and postnatal. And I think at the time, NASM was the only accredited certification that had that. So she was NASM certified to teach pre and postnatal to coaches. And so everyone at our gym, it was a large gym, probably 20 to 25 trainers in this location, was certified in pre postnatal. And it was all women clients, and 80% of women are pregnant or going to be postpartum for life. So they really emphasize that we should be focusing on it and, getting women comfortable strength training around just like the movements of motherhood, but the lasting symptoms that come from postpartum as well.
I think that's super important. I don't think a lot of women realize how active they're able to stay during pregnancy
Mm-hmm.
and some of the things that it takes to get back to their normal post pregnancy.
Yeah, yeah. Um, the advice I would say standard that doctors give, even now, is just you can do what you have been doing, which is both great and not true. So you can definitely, if you have never strength trained and you want to start at 20 weeks pregnant, you can absolutely start at 20 weeks pregnant. It is all just, you know, working with somebody who knows what they're talking about, for one, but um, meeting where you're at. You don't need to jump into a huge class and, do intense conditioning or really heavy weights or anything like that, but there's something for everybody. And most certainly after pregnancy, regardless of your fitness level, um, you should be starting very slow and, methodically in what you're doing and not just hopping right back into what you were doing previously.
Yeah, can we dive into that a bit more? Like
Yeah.
some of the typical issues that you see with women coming back to the gym.
Yeah. So, I mean, pregnancy, regardless of how you deliver, but pregnancy in general just does a number on your body. It changes your posture, and it actually can change the physical structure of how you were built. So a lot of women will get, a much wider rib cage, much wider pelvis, and all the muscles that accompany those joints get tight or weak or, you know, are in just different fixated positions. So they're not used to working at the capacity that you're going to have them working at. Um, of course, pregnancy does a number on your pelvic floor. And so any type of load or pressure on your pelvic floor is going to cause, pain or leaking or, um, incontinence, even fecal. And so when somebody is starting a strength program or starting back up postpartum, it's super important that they see a pelvic floor physical therapist. Um, a physical therapist can do an internal exam and can do a little bit more of a hands-on exam to give you an idea of where you're at. And then certainly they can give you rehab, or you could see, a postpartum certified strength coach to help you. But it's a lot of breathing exercises. Um, it's a lot of trying to bring mobility back to areas like your rib cage that is going to be expanded and stuck in a position that's not necessarily friendly to everyday activity. Um, so, in order for women to be avoiding back pain and hip pain and pelvic floor pain, we want to get people back into a posture that's not, this super extended big belly posture that they've been in for the last 9 months.
Yeah, that's great. I know in the CrossFit space, we run into athletes, postpartum athletes a lot, who get that leaking during box jumps or jumping rope or bearing down and lifting heavy weights, and just think that that's their new normal and that's just the way that it's going to be forever.
It unfortunately is treated like it's very normal, but it is not. And it's not
Yeah.
comfortable. Nobody wants to be, the amount of women that I've had tell me that they wear a pad everywhere in fear that they're going to pee their pants when they're doing something physical is awful. And it doesn't have to be that way. And, all women get the green light to do what they were doing before at the 6-week appointment. And in reality, most women, all women, need at least 6 weeks of building some sort of base and strength in their core before they're introducing anything that has impact. So box jumps and jump rope and, sometimes even just quick snappy movements like kettlebell swings or snatches or cleans, even though they're not direct high impact, they still put a lot of pressure on your pelvic floor. Um, and so figuring out how to use your body again is super important to getting back to those things that you want to do.
Yes. And I believe the saying is, it's those problems are very common, but they're not normal.
Yes,
Yeah.
exactly.
So yeah, that's an important thing that I think needs to continue to be spread through all athletic communities.
I agree. And it is growing, which is wonderful to see since I've been in this field, you know, for the last 9 years, it has grown tremendously. So it is improving.
Yeah, that's fantastic. Um, you have a child yourself, is that correct?
I do. Yes.
Yes.
He's almost 2.5.
Nice. So did all of this knowledge and having worked with these types of individuals in the past help prepare you for your own journey?
Tremendously. It really did. And I had always joked with clients prior to, having a child myself, like, you guys are really preparing me for everything because I heard it all. And in some ways that was terrifying. But, all the things that I went through, and I know for a lot of women, they just don't have somebody telling them that it's happened to them too. And I thankfully have been in this field, hearing these stories from people, and I could always reassure myself, like, this is normal. This feels fine. It's okay that, I can't do this movement anymore, that I'm not lifting as much, or, I think for me in the first trimester, I was so sick, and I had a lot of clients who were sick in their first trimester as well, and that really got me through because I went from being able to deadlift over 200 pounds one day to like 135 being immediately hard. So having some sort of marker did help it feel less failure-ish, which nobody should feel that way, but that is just human instinct.
Right. I used to be able to do this and now I can't.
Yes. Yep. Exactly.
For sure. Do you feel like you're back?
I do. Yeah. I think it's fascinating because, like I said, we have that 6-week marker, and they're like, "You're good. Go ahead." I think it took 2 years for me to feel like myself again and feel like my body was mine. Um, like my strength was roughly where it had been before. And, we want to come back as fast as we can, but it just doesn't. For some women, it's less tumultuous, but for some of us, it takes longer than 2 years too, and that's okay as well.
Right. You're at the 6 week mark. Congratulations. You might not be sleeping because your kid is awake every 3 hours, but you can go back to your normal activity.
Yes, exactly. It's too
Yeah.
much.
Yeah. What do you love the most about personal training?
I just love seeing clients just hit things that they never thought they could. I really do. It sounds so cheesy, but you look at somebody do a push-up for the first time, or you see somebody hit a weight that they like couldn't even fathom them being able to lift before, and their face lights up, and it just like those are the moments you live for. Or somebody comes in, and one of my favorite clients of all time was this man in his 70s who had never strength trained ever in his life before. Didn't even want to. His wife like forced him into it, and he was so excited because he was able to put his suitcase in the overhead bin. And I still remember, that was probably 6 years ago. I still remember that moment and just being so excited.
Nice. Focusing on the small wins.
Yes, exactly.
Awesome. And you have a blog, right?
I do. Yeah.
Can you talk about that for a little bit?
Sure. Yeah. So at Iron Legion, I'm the head coach there, and I feel pretty passionate about the education that our coaches have. All of our coaches are, of course, certified, but I want them to always be learning. And so a small idea kind of turned into a big idea, and I ended up starting a blog called The Break Room. I was fortunate enough when I started this career to actually be in a big box gym. I know maybe it's more trendy now to have these small personal training studios, but at the time, being able to work in the same room as 20 other coaches, I learned so much. I just like soaked it up like a sponge. And um, when the pandemic happened, we all kind of lost that. Even at Iron Legion, we were all kind of in our separate rooms, and you couldn't look across and be like, oh, I like that exercise, I'm going to use that, or I forgot about that, or I'm going to ask them about this, thing that they were trying with the client. And I just felt like we needed it back. And I wanted to create an online space that could have that. So I made this blog called The Break Room. And the idea was that I'd have, a variety of coaches and health professionals, personal, physical therapists write in a specialty that they want to share with other people in the industry. And it has grown a little bit. I have a little tab on there for like continuing education that coaches can find online or local to New England. Um, and yeah, it's been a fun little passion project for me.
I love that. So that you told me previously, it's like everything from little cues to give athletes to certain exercises to help in their training, or
Yes. Yeah. So I have a little piece on there called coaching cues. So occasionally I'll write like a small, like, for example, break the bar for tighten your lats, or some sort of verbiage that just gives coaches like a quick little read. And then I also have a few um, PTs and pelvic floor PTs that I've written about more specific topics, like how hip and back pain relate to pelvic floor pain, um, and various topics like that, so that people can go on and read a little bit more extensively.
great. And again, the target population for that blog is other coaches.
Other coaches and other health professionals, yeah. And then we are going to start incorporating a little bit more for our clients on there too.
Oh, sweet. What are you hoping to get on there for them?
Just little things that they can do to improve their consistency, their nutrition, their movement quality. So there'll be all kinds of little like tips and tricks, and I'm hoping, for just more little quick read type blog posts from some of our coaches at the gym.
That's great. So where can people go to find out more about Meg, her blog, all that kind of stuff?
You can find me on all the socials: Facebook, Instagram. My Instagram handles Seehagen Strength, so my last name _ strength. You can connect with Iron Legion Strength Co. on their website, and we have all kinds of information or a contact form through there. And then the blog is called thebreakroom.blog, and all my contact info, YouTube, that kind of stuff is located there as well.
That's great. And I'll get all that in the show notes along with that squat study that I referenced.
Awesome.
Yeah. Any other parting words for the audience?
Parting words? No, I don't think so. I think, if there's anything that you have been wanting to try ever, like, go for it. Like, find a community that you can relate to, and just find a way to bring strength into your life. It will always serve you well, even if it's 20 minutes a week, or you can build on it from there. But do yourself a favor and add some strength and self-care into your daily life.
Love that. You can never get enough strength.
No, that's right.
Perfect. Well, Meg, thank you so much for hopping on here.
Awesome. Thank you so much for having me.